Well, of course, our pets are members of our family, and when they come down with a serious illness like cancer, it can be heart-wrenching. However, just like medical care for humans, cancer treatment in animals aren't unlimited to chemotherapy. Dr. Ruth Roberts joins us from Sundog Cat Moon Veterinary Clinic. And, welcome, Doctor, and Merry Christmas, and coming up, Happy New Year.
Merry Christmas, Happy New Year, Tom.
Yes. A lot of folks that have cats and dogs, a lot of times they don't think that their pet can come down with cancer as well. But it's all over the place with cats and dogs sometimes.
It is. And the scary thing, too, is that for dogs in particular, we're starting to diagnose it very much younger, so often at the age of 6 to 8 years of age. We think of cancer as something that happens to much more elderly pets. And unfortunately, they're really getting into middle ages when they're diagnosed at this point.
And the chemotherapy, if the animal needs chemotherapy, we're talking kind of like dogs right now.
Right.
The doses are much lower than in humans, according to weight and so forth, right?
That's right. And so the goal for humans, often for chemotherapy or cancer treatment, whether that involves radiation or surgery, is to cure the disease. And our goal for pets is to put it into remission, if possible, or cure. But the doses are much lower, so the side effects they experience are far fewer.
And you could also, with some of the side effects, you can give them medication just like in a human
exactly.
to try to alleviate nausea. Give kind of a little example. A dog comes in and there are some symptoms there and it's diagnosed with having a type of cancer.
Right. So for instance, one of the more common cancers in dogs and cats is lymphoma. And for many dogs, they are diagnosed simply because they've got some bumps under the neck. So the lymph nodes begin to swell up, things of that nature.
The owner notices that by petting the dog, and there's a couple of bumps there. I need to take it to
exactly.
the doctor. Yeah.
Exactly. And so from there's several options. And we are fortunate to have actually 3 veterinary oncologists in the Charleston area. So they're a great resource for both pet owners and veterinarians that are seeking further information about a specific type of disease. So once that disease is diagnosed, then we can give the pet owners some different options about treatment. And lymphoma happens to be one of the best cancers to have in the sense of often with chemotherapy, they get into remission for a very long period of time. And again, the chemotherapy side effects are very, very few, and that's just been so helpful for these guys. They can get well and get feeling well before they actually even know they're sick.
So depending on the severity of the lymphoma, the cancer may need surgery, may need chemotherapy?
Generally with lymphoma, it's limited to chemotherapy, so that's the mainstay of cancer treatment for that particular disease. There are a few alternatives that are starting to pop up because unfortunately there is a significant cost associated with chemotherapy. So one option is metronomic chemotherapy.
I was going to ask you about that. What exactly is metronomic?
So what that means is that you use low doses over an extended period of time. And so instead of a once a week high dose, massive dose of 1 or more drugs, there might be a very low dose daily of 1 to 2 drugs used over a period of time. And of course the effect is not as good, but it does often get those pets into remission for a period of time so that they can enjoy more time with their families.
Talk to us about diet, because that seems to be just as important in our animals as it is in humans, with being able to at least stay away from certain cancers or at least help in going through the cancer period.
Yes, and the thing with diet is that most cancers love sugar as their fuel source. So if we limit the amount of simple carbohydrates and sugars in the diet, then we help the pet get good nutrition, but we don't feed the tumor. And that's really the goal, is drop the carbs down.
Sugars?
Yes.
Wow. That's
sorry to say. It's bad no matter where you slice it.
And that's not only prevalent with animals, but with humans as well.
Exactly.
Yeah.
And much of that data comes from the human side.
You just touched on my sweet tooth. That's
no,
for sure.
It's a painful thing to lose.
Yes. Talk to us about maybe getting into the Chinese medicine, maybe some acupuncture as well.
Right. Acupuncture can often be helpful. And again, Chinese medicine is a whole separate form of medicine. And so we might use acupuncture, we'll use food therapy, and then Chinese herbal medicines. And in fact, Yunnan Baiyao is a very commonly used formula in Chinese medicine. And interestingly enough, it's been shown to reduce blood vessel growth into a type of cancer called hemangiosarcoma, which is becoming very common in dogs. So that's an amazing thing. Here's this formula that's been used for thousands of years that has great relevance to today's medicine.
Where are you guys located? located?
We're out on Johns Island, just a half a mile away from the River Road and Maybank Highway intersection.
Wow, I've got about 10 more seconds left.
Sure.
Somebody comes in with an overweight dog or cat. They say, gosh, you know, this is my New Year's resolution. I got to bring the animal in first, second, somewhere there of January. Can you help them out with a diet and get the cat or the dog back on the healthy track?
Absolutely. And you know, the original Crock-Pot diet is what we really promote strongly to our patients and our pet owners because it provides that weight loss, gets the physiology working better. But there's several different options we can come up with to help use commercial foods too.
So that's where you need to take them right there.
Yes.
Dr. Ruth
Thank you.
Roberts, thank you so very much.
Great to see you, Tom.
Happy New Year to you.